Guys, welcome back to Medical Coding with Blue. Today's episode is all about tips for studying anatomy for medical coders. If you're brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so I got an email. I'm gonna read the email and we're gonna get into it. So here we go. The email says, "Good morning, Blue. Is it good for me to memorize the human anatomy from A to Z? That's how I used to study when I was younger growing up. What is your suggestion?" I have shared my suggestions so many times about study tips. I have many videos on my channel about tips for studying anatomy, tips for studying medical terminology. Guys, just go through the videos. Just go through the videos. And even though the video may be a couple years old, it's literally going to be the same thing that I'm going to say current day. When it comes to studying, I will say this though. As however you studied when you were a child is not going to be the same as you would study as an adult. Because as adults, we've got so much things going on. We got so many other things going on that our study habits and the way that we retain information is going to change. So however you felt like you learned best when you were a child, you need to kind of like put that to the side. And when you are learning medical coding, and even if you are a veteran coder right now and you're thinking, you know, oh, I don't need anatomy. Oh, yes, you do. We all need anatomy, because trust me, you're always going to learn something new. But take the time to set up a schedule for yourself to study anatomy, and study for 1 hour at a time, you know, no more than 1 hour at a time. Because this way it'll give you a way to retain this information. It's not going to bog you down. This makes me very nervous when I hear somebody say, should I learn human anatomy A to Z? No. The thing that I say is it's not about memorizing. It's about understanding. And it's about having a grasp of what's happening. So the best way to do this is to break down anatomy, not by just like the whole thing all at once. You know, you have to break it down by the systems. First, learn the bones, then learn the organ systems, the organ system groups and where they are and what do they do. And then learn your muscles. Start with those three. So you learn your bones, your organ systems, and your muscles. And when you do all of that, that's more manageable. You can break that down. There's a lot of posters out there. There's a lot, again, my links are in the description box for all the stuff that I recommend for anatomy. In your medical coding books, they do have anatomy plates in the back, so that way you can look at those, hang them up where you can see them. That I will say, when we were kids and, you know, we were in school and we had the teacher who had the posters up and everything for the letters and the numbers, it is the same way. We have to have that constant stimulus. So wherever you have your study area set up, because it is important that you do have a study area when you're studying medical coding. Wherever you have your study area set up and put anatomy posters and break it down so that way you can see them. And then get yourself some flashcards. The ones that, again, that I recommend are in the description box below. I have the Barron's set of anatomy flashcards. And so that was how I learned. And it's just about exposing your brain to that stimulus constantly of when you're studying of like anatomy. And again, breaking it down by the bones and breaking it down by the organ systems and then breaking it down by the muscles. And then you can further break it down and you get more specific. You know, a human anatomy is so important to us as medical coders. Reading and learning and understanding medical terminology is the biggest thing that we do. It's not about just punching in numbers. It's not about, oh, well, the codes are already selected, so I'm going to push them on through. No, you have to make sure that everything is supported. And understanding that language that's in the documentation is the first step. Because what if you saw a patient who was having an issue with the gastrocnemius muscle, right? Well, what you would think, oh, well, that has nothing to do with, that must have something to do with the stomach, right? Because you say gastric. No, it's actually the calf muscle. So that's in the lower leg. And what if the patient had an issue with the talar shoulder? If the provider described it as an issue with the talar shoulder, Wouldn't you think, oh yeah, that's in the shoulder? Wrong, you'd be wrong. That's in the foot. So things that may say that they're a certain thing, like shoulder or gastroc, they're actually not even related to that. It's actually in a different area. So that's why you have to learn these things. But the only way you're going to be able to learn these things is if you take the time to understand, again, the three most important things: the bones, the organ systems, and the muscles. If you can get these three down, then you can start working on the details. But don't overwhelm yourself with all of these things thinking that, oh, I need all of this so that I could be a good medical coder. No, you need the broad strokes first. Then you can work on the details. Because as long as you have a general understanding, it's not going to be so overwhelming when you're trying to read these things and you're like, I don't really understand this. But if you understand, again, the broad strokes, it'll be a little bit more, oh, okay, well, I just got to look up this detail, or I got to look up this detail. So it's not going to be so hard. The thing about it is you can't just go in there, just thinking that you're going to just grab everything and learn it all and it's going to automatically absorb, because it doesn't. Even nurses who study in nursing school have a hard time. Doctors also have a hard time too. I follow quite a few on various outlets of social media, and some of them have said that their worst subject that they hated the most was anatomy because they hated it, and they just got overwhelmed with all the things that the body does, and they're doctors, so that should tell you something. But again, it's very important. And just because we have certifications and maybe you have a high school diploma or a GED and that's it, it's not an excuse for not understanding what you're doing. Because there's a lot of people that will say, well, I'm not a doctor, so I don't care, I'm just going to do whatever because this is my job. No, you have to care. That's exactly what you have to do, because at the end of the day, you are responsible for those codes that are being selected. Even if the codes are already pre-selected and you're making sure that they're all okay before you send it on through, you are still responsible for the selection of those codes. And you have to answer for that every single time. So that's the thing, that you can't take it for granted. And coming in with a lot of knowledge is going to help you. And still continuing to build on that knowledge will really help. Take the time to check out YouTube. Let your fingers do the walking and check out those channels for anatomy. And again, it doesn't have to be for medical coders. It could be for anybody, right? And there's tons and tons of channels to be discovered. Now, I used to put out my recommendations on YouTube in the description box, and then I had people ungrateful, okay? So I said, okay, fine, I'm going to leave that for my Patreons. So anytime I find anything good on anatomy or even on Instagram about anatomy, I send it over to my Patreons because they're the first to know. And that's the thing, guys. So do your research so that way you can start building those references that you have. And just listening to those anatomy channels will really help you. If you don't feel like looking or reading a book, just listening, just a simple act of listening, your brain is going to retain some of it at least. And I would rather people retain 10% of an anatomy channel than 0%. And you only get 0% if you're not listening to anatomy channels. All right. And it's as simple as when you're driving in a car, you're driving to work, you're by yourself, and then you can hook that Bluetooth up and then just listen to those anatomy channels just like you would the radio. Okay. So it's not anything that you have to be like watching. You can just be listening. Okay. And that's the thing, guys. You can squirrel in those little pockets of time. When you are on a break at work, you can pull out your flashcards. And if you're working on the bones, okay, then you could just work through your bone flashcards. If you are working with the muscles, again, you could just be working through those. And it's going to get you better and sharper as you have more practice. But again, you're not going to get that way if you don't do it. And so it's very important that anatomy is not something that you can skip. A lot of people ask me, oh, well, is it really necessary? Do I have to have the anatomy? And I'm like, you don't want to get into this field without having anatomy. And if somebody says, well, I got into it without having anatomy, then you either had a previous background in medical, or you are not getting as specific a codes as you could be if you really understood what you were reading. So that's something that you guys got to know. I mean, this is not something that you can fool around with when it comes to reading these notes and understanding the anatomy. You know, there's a lot of other things in the body that are called different names. Like you get into anything in podiatry and you start hearing Lis Franc. Look that up. You're going to see that that's not exactly the easiest thing to code. And I've had to do many education about this. So it's a very fascinating group of bones, but that's something that you will learn with time. And again, if you are not learning these things, you are only hurting yourself. You're hurting your provider, and you are certainly hurting the patient, because not understanding what's happening to them is going to affect the code selection. Okay, so my advice, again, let me reiterate this. Hang up anatomy posters. If you don't want to buy the ones that are in the Amazon affiliate links, that's fine. You can look on the internet. There's plenty of like worksheets and pictures and images of anatomy that you can download, that you can print out, that you can hang up so that you can see it. So that way you can constantly see it. That's why you see doctors have their anatomy posters hanging up in the doctor's office. You think that's for you? No. That's to remind the doctor of things and where they are and things like that. So if they have to do it, you know that we have to do it. All right? So do that. Hang those posters up. Get those flashcards and start working with flashcards. You know, whatever flashcards you want to. Some, like the Barron's one, it has like the image on one side. You flip it over. It's got the whatever the name of it is. So that way, you know, it's just easier to learn that way. But don't make it so detail oriented and hard on yourself where you're going to want to give it up, because it is a lot. You know, as somebody who has taken a human anatomy course, it is not the easiest thing, guys. It is not the easiest thing. And it will make you pull your hair and like question yourself, like, what am I getting myself into? But as you continue on in it and you start picking these things up, it just makes it so much better. And you start to realize that, hey, maybe I am doing something right here. So practice that way. Again, there's a lot of anatomy plates in these books. There's so many resources on YouTube. On my Patreon channel, if you don't know, Patreon's a lot like YouTube. On my Patreon channel, I do all kinds of, sometimes I have like pictures and things like that for anatomy, and I do anatomy quizzes all the time. There's also anatomy coloring books. So if you're interested in doing something like that, you know, there's of course the link in the description box below for Amazon, the one that I recommend. But coloring books is another really great way to learn anatomy. That was again how I learned in the beginning. So it helped me. And engaging your mind and your brain and your body when you're learning is what is going to help you retain, you know, whatever it is you're trying to study. Okay, so you can take anatomy in little bits at a time, so that way it doesn't get overwhelming. You can do it in conjunction with your studies when you're studying for medical coding, because again, that's the only way you're going to learn, is when you start to incorporate all these things together. If you're reading a note and something doesn't make sense, you need to immediately stop and look it up and find out what it is, so that way you're not just trying to guess. Sometimes you can use the context clues and, you know, be able to figure out, you know, what they're talking about. But it's always best, if you don't understand something, to immediately stop and look it up. And if you say, well, Blue, I have to stop and look things up all the time, then that just means that you're going to learn a little bit slower, but that's okay. It's always going to be about accuracy first, rather than, you know, just trying to rush and race through. It's not a race, guys. It's not. And again, hands down, is always going to be about accuracy. So the only way you're going to get more accurate is the more you know about anatomy. Okay, so don't try to skip it. Don't try to think that you can get away from it. And medical terminology, I've heard some teachers People say that the teacher said, oh, you can learn that on the job. No, you can't. You can't, because you know what? Even if you pass that certification exam, the medical coding certification exam, without an anatomy course, without a medical terminology course, you will be ill prepared when you get out in the real world. And that credential won't mean anything if you can't back it up with knowledge when you're being tested on those assessment tests. Because they will give you an assessment test when you start. I'm just saying, you know. I want you guys to be set up for success. I say this a lot because a lot of people think, oh, you're trying to discourage people. No, no, I'm not. I'm giving you guys a reality. This is a reality check, because honestly, you know, when you think about everything that goes into medical coding, I shouldn't get this question. I should not get this question at all. Do we have to have anatomy? Do we have to have medical terminology? And I still get it. So that's the thing, guys. I shouldn't get this question because of the simple fact that it's all about medical terminology and anatomy. You are in a hospital setting. You are in a medical setting. And that's exactly what they do in a medical setting, is they talk about in medical terms and they talk about anatomy. So that's a big part of it. So again, taking the time to break it down, learn your bones, learn your organ systems, and then learn your muscles. Then you can further break it down into the tendons, and you can further break it down into all these other things. But you need to start with those three, so that way, okay, we know which way we're going to go. And there's also a ton of workbooks available on Amazon. You could just type in anatomy workbook, and you'll see a ton of them come up on Amazon. You can go to Barnes & Noble or wherever you get your books. You can go on eBay, anything. And just take the time to break it down and learn a system at a time. You know, if you want to take a week to work on a particular system, by all means, and then circle back and continue breaking it down into other systems and to other things, that's totally fine, guys. You know, it really does have a lot of room for however you learn best, because adults learn differently than children. And so if you're going to go that way, give yourself a workbook to work on. And so that way you have some focus, but you can also incorporate other things like the flashcards and, like, you know, looking at the posters, listening to the channels on YouTube for anatomy. At least that's just what I would recommend anyway. But yes, try not to get overwhelmed, because it is a lot. Know that you will fall, and there will be things that you will forget, and there will be things that you don't like, but it's all part of the package. And it's at the end, I think it does pay off. I have a career that I don't even feel like I'm working when I'm at work and when I'm coding, because I love it that much. And then I come home and I have a channel where I talk about medical coding. That's the payoff for me. I don't feel like I've been working. I don't feel like I've been working since 2014, when I had my aha moment. And that's when all of my studying really kicked into gear. Okay, so there's one other thing before I wrap this one up. There are some phrases that you can come up with to kind of help you to retain some of that information that will really help. There's a lot of really good, cute ones out there, and so that's something that you can look up as well, so to kind of help you to, like, remember things how they go. But again, it's all about getting creative in how you're learning, and pick what works best for you and do that. If you need to write things out, write things out. If you need to listen, if you need to, like, visualize and see things happen, there's a lot of videos on YouTube. There's even videos on surgeries, and that was how that helped me to when I was surgery coding as well, because to actually see the surgery in action, really, okay, now that makes sense, because now I can see in the anatomy where it is, right? And then learning and listening to them say these names, like olecranon, you know what I mean? Like, I didn't know how to say that, because when I read it, I would say olecranon, and then they're like, no, it's olecranon. I'm like, oh. So you learn those things along the way too, and you pick them up. That's the only way you're going to do it, guys. You have to immerse yourself into that lifestyle. You have to immerse yourself into those things. And I've mentioned before, watch House, the show, House MD. They have all those shows that are on there. They talk about anatomy. They talk about the disease process. And all of those disease processes and things that they talk about on there, those were all modeled after real life cases. So that's another little fun fact about House, which I thought was fascinating. But if you're just listening to it, again, you're exposing your brain to those things. And you're going to learn how to pronounce those words too. I'm just saying. So, good luck to you out there, guys. Make sure you get out there and you study. Don't give up and don't give in, because you can do it. And as long as you know the basics, you'll be just fine. You'll be able to get going from there, and you can build on that knowledge over time. All right. So if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.